Good evening, everyone. We are thrilled to be here with you tonight with the Bennington pediatricians. My name is Brina Holmes. I'm on the American Academy of Pediatrics board. I'm a pediatrician, and I am delighted to welcome Meghan Gunn and Judy Orton, your amazing local, very well-versed in COVID vaccine pediatricians. We're gonna wait just a minute or two to let people join, and we'll get started with some information, a PowerPoint, and then we're really open to question and answer. We want you to let us know what you'd like to talk about beyond what gets talked about in the PowerPoint. So we'll just wait another minute and then we'll get started. Okay, let's go ahead and get started. I'm going to turn it over to Dr. Gunn and Dr. Orton. And just a reminder that we would love to know your questions. So please use the question and answer, or if it's a small enough group, we can, at the end of the PowerPoint, just have people ask their questions verbally, whichever you prefer. Take it away.
Perfect. Thanks, Brina. Hey, everyone. I'm Meghan Gunn. I'm going to be talking a little first, and then my partner, Judy Orton, will take over. Thanks so much for being here today, and we welcome your questions. I'm kind of going to zoom through this a little bit with some general information, and then I'm excited to hear questions. So today we're going to talk about protecting our young Vermonters with the COVID vaccine. Some common questions that we get from families, which may be some of the ones you have tonight, is, does my child need to get vaccinated? What are we protecting them from? And what are the risks of vaccination, which we'll cover those tonight. How do COVID vaccines work is a common question and misconception. So I'm excited to talk about this. Really, the vaccine works similarly to other vaccines that your child has received. And basically we think of, so the pathogen that causes the COVID virus is called SARS-CoV-2. And those virus particles can invade and multiply inside the body. And the point of the vaccine is to stop that multiplication by helping our own immune system make special proteins called antibodies to fight the virus. So after vaccination, your child has less of a chance of getting COVID-19 infection. And then if they do get infected with the virus, typically they're not as sick as they would be without the vaccine. Ooh, sorry, my computer's fallen over. There we go. How effective are the vaccines? So research does show that all of the COVID-19 vaccines are highly effective in stopping people from getting COVID-19, and they definitely prevent serious illness, hospitalization, and death in those who do get COVID-19 versus the people that are unvaccinated. And a lot of people ask, why are we needing boosters? How long do the vaccines really work? If they work, why are we needing boosters? And really, this is such a new virus that scientists don't know yet how long the immunity from the vaccine will protect us. And that will become clear in the future as more studies are done. So how do we know that the vaccines for COVID-19 are safe for youth? And really, they are very safe and effective for both adults and kids ages 5 and up. And this has been done and studied through many randomized placebo-controlled trials for various age groups. And even, we're going to talk a little bit more about those, but even after those are done, it's not like that's the end of it and we kind of stop looking at the efficacy and safety. The vaccines continue to be monitored really closely. And the CDC has said that the COVID-19 vaccines actually will have some of the most intensive safety monitoring ever even compared to other vaccines that your children have gotten. So we're specifically talking about the Pfizer biotech COVID vaccine because that is the one right now that has emergency use authorization in the 5 to 11 age group. So timeline is December 2020. There was the EUA for those 16 and older to receive Pfizer. In May of 2021, that was extended to 12 and 15-year-olds. And the CDC also supported and recommended use. And then in August 2021 is actually when full FDA approval went through for ages 16 and older. And then the end of November 2021 was the emergency use authorization for the 5 to 11-year-olds for a pediatric dose. And the CDC also recommended the use of that. More about the vaccine in the US, over 100 million people have been fully vaccinated, which means at least 2 doses with this specific Pfizer biotech vaccine, and 15.5 million youth ages 12 to 17 have also been fully vaccinated. And then the latest data that we have was as of November 30th, over 4 million children ages 5 to 11 had received at least 1 dose of the pediatric Pfizer vaccine. Specifically for when we say pediatric Pfizer vaccine, we mean the vaccine and dosage that's used for the 5 to 11-year-olds. So some differences are that it is a smaller dose than the dose that the 12 years and older get. It's only 10 micrograms rather than 30 micrograms. And so some people would say, well, how do we know that that's enough for this age group? And really the things that we're monitoring are the immunity or the immune response to it, and then also the safety. Sorry, someone was just checking in. So there's a similar immune response in the pediatric vaccine dose as compared to, the 16 to 25-year-olds, and then efficacy showed a 90.7% efficacy against COVID-19 infection, and that was collected during when we had the Delta wave, and no serious adverse events related to the vaccine were found. This is a little confusing even for me, but I think I figured out. So what they're trying to talk about in this study overview is that there are phase 1, 2, and 3 randomized, blinded, placebo-controlled trials that are looking at immunogenicity, which is kind of looking at the immune response, and are these patients, these children, making enough immune response to the vaccine. And they also look at efficacy along with that. So when they do make an immune response, how effective is it at preventing COVID infection? And then safety is also looked at. So in phase 1, they were looking really at the doses. So they studied 5 to 11-year-olds, and they looked at doses of 10, 20, and 30 micrograms, which 30 micrograms is the 12 years old and above dose. And then after they were looking at the dosing, they also looked at the safety. They looked at both the safety and the immunogenicity, and they found from phase 2 to 3 trials that the final dose was set at 10 micrograms. They then took this age group and did some more randomizing trials with the Pfizer vaccine and also placebo 3 weeks apart. And they were looking at I have trouble saying this word, immunogenicity data, the efficacy data, meaning how good is it at preventing COVID infection, and then again, that safety data in those two cohorts. So the point of all that is this is well studied. Again, like I said, the 2 things that they're really looking at in the studies are safety. So is this dose safe for these patients? And also, number 2, is it effective at creating an appropriate immune response to fight the viral infection? So what about side effects? Some people have no side effects. I feel like, as with most things, we usually talk about when we don't feel good, or if we have a bad experience going to a restaurant, we're more likely to share that with our friends than that we had no side effects. So it's actually not uncommon to have no side effects, but the most common ones in the age group for 5 to 11-year-olds are local reaction, including pain at the injection site, redness and swelling, which, as you all know, can occur with many vaccines. And then systemic symptoms, meaning overall symptoms of like not feeling well after, actually are at a lower rate in this 5 to 11 age group. And we'll go through a few charts, but the most common in this age group are headache and fatigue, and they're pretty mild. And then they're temporary and they go away within a few days. These are those charts I was talking about. So I wish I had a pointer. I was going to point at my screen, but you guys can't see that. So we're looking on the top row, thank you, at dose 1, and the bottom row at dose 2. And you can see they're looking at the top at redness, swelling, and then pain at the injection site going across the top. And they're looking at the appropriate age dose, so a 10 microgram for 5 to 12 versus placebo, and then 30 microgram for 16 to 25 versus placebo. And you can see for dose 1, really the largest side effect between those 3 was pain at the injection site. And that was actually more for the 16 to 15-year-olds. And you can see that that occurred even in the placebo groups for both groups. And then for dose 2, it was similar, with the pain at the injection site being the most common reaction. And then you can also look, redness and swelling are present, but not nearly as common. This looked at those systemic symptoms, so which are their overall body symptoms. And the top chart is when they received the vaccine. The bottom chart is when they received a placebo, which means not a real dose, or kind of, I don't want to say fake dose, but they have to compare it to something. So the person still thought they were getting potentially the COVID vaccine injection. Sorry, there was just a page overhead. So you can see in the people that got the actual COVID vaccine in the testing group, most of their symptoms were the fatigue and headache. And you can actually see when you compare the 5 to 12-year-olds versus the 16 to 25-year-olds, the 5 to 12-year-olds had it actually less commonly. You can see about a 40% of the 5 to 12-year-olds had fatigue, and about 28% of the 5 to 12-year-olds had a headache. You can see things like chills, muscle pain, joint pain, and even fever were present, but much more common in the older 16 to 25-year age group. And then again, you can see even with placebo, there was a fairly significant amount of fatigue and headache after the vaccine. So what about vaccine-associated myocarditis? A lot of people have probably heard about this in the news and other places that they get their information. So myocarditis is inflammation of the heart muscle. And it's important to note that there were no cases of myocarditis in the 3,000 5 to 11-year-olds who received vaccine in the trial. We do know that there is an increased risk of myocarditis in 12 to 17-year-old males after they receive their second dose of Pfizer vaccine. But I think the main point is to know that this is extremely rare. And even in the most affected group, which is 16 to 17-year-old males, the rate of myocarditis after the second shot is about 1 in 10,000, or 0.01%. On the next page, we're going to talk a little bit about, some people will ask about, so if you can get this, isn't that dangerous? Yes, of course it's a concern. That's why we're paying attention to it. However, you can also get myocarditis from COVID-19 infection. I don't have the numbers here, but it's actually, you're more likely to get myocarditis from COVID-19 infection. And there's a difference between those two types of myocarditis. So a child is, like I said, more likely to get it from infection versus vaccine, and vaccine-associated myocarditis is usually much more mild than that caused by the true infection. So when you weigh out the risks and benefits, the vaccine is more likely to prevent myocarditis than actually cause it. And then what about late onset side effects? I know this is asked about a lot too. And no new vaccine side effects have ever been documented after 8 weeks post-vaccination, and there's no mechanism by which this could cause a new long-term problem, because when you actually get the injection of the Pfizer vaccine, it's an mRNA. So that is a type of protein. And I actually listened to a podcast that I thought described it really nicely. They said basically the mRNA is like a recipe for your body. So it gives you the recipe for your own body to build and assemble the antibodies against the SARS-CoV-2 virus. And so that mRNA within a few days has been degraded and broken down by your body, and it is not something that stays with you or becomes a part of you. I think Judy's going to take over now.
So what are the risks of an infection in this age group, which, is important to understand so that you can weigh the risk versus the benefit of vaccines. So far, since the pandemic started, we've had over 8,300 hospitalizations. The data that we have nationally is early October. A third of these children ended up requiring ICU admission. As you can see, there's not very many deaths. There's only been 94 deaths. 1.7%. There'll be some people who say, hey, it's only 1.7%. But remember, children are not supposed to die from infection. This is now the 8th leading cause of death in children. Why do we have other vaccines? It's to prevent childhood death from preventable infections. COVID is one of those. The number of cases in Vermont, and as everyone is aware, is increasing over the fall into this early winter time. Still, the total pediatric cases are still small, but the 5 to 11 group is leading, or the under 11 group is leading in the number of cases, as would be expected because they're the least immunized. Rates, you can see the rates by age. The 6 to 11-year-olds have increased there, 99. There was a little dip around Thanksgiving. Some of that reflects that I know here locally we weren't testing at all unless you ended up in the ER between Thanksgiving until that following Monday, because all the testing sites were closed down. So some of that is reflected of that. But overall, if you just kind of look at the average trend, we're gradually increasing, and we want that number to go the opposite way. And we have means to do that now with the vaccine. Cumulatively across the country, you can see Vermont rates in the lower third, but we're not the lowest. We're certainly not the highest. Overall case rate is nearly 9,000 per 100,000 children in the population. 16 states have reported more than 12,000 cases. Again, Vermont is a little bit lower, but I would love to see it being the lowest. That's when being number one, being the lowest is the best, and not up there with the southern states. At least one, this graph reflects the number of proportion of children who've been vaccinated for the 12 to 17-year-old group. Vermont sits at 83%. I think Massachusetts is neck and neck with us. 83% is awesome. Certainly would love to see that above 90%, as in most vaccines historically, and I've been in practice long enough that I've seen this, that if we can get that vaccination rate above 90%, we have a higher chance of preventing even more disease spread, because there's less people being susceptible to it. What can COVID cause? One of the big things is pneumonia. So just like in adults, it can lead to low levels of oxygen, requiring hospitalization for oxygen supplementation. May also require support from machines to assist in breathing. Adolescents are probably the highest, have the most severe disease due to the Delta variant, but we have a pretty high adolescent vaccination rate. So we're not seeing as many really serious disease cases in our younger population. Certainly unvaccinated adolescents nationally have a 10 times more likely rate to be hospitalized due to COVID than the vaccinated adolescents. So, continued due diligence to try to convince parents and adolescents that are not presently vaccinated to go ahead and have that done. So some of you may have heard about Miss C. It's, you know, been in the news off and on throughout the pandemic. It requires a very specific case definition. It has to have recent or current COVID infection, in addition to laboratory evidence of inflammation, evidence of severe illness requiring hospitalizations, and 2 or more organ systems involved. Oftentimes it is the heart muscle becoming inflamed, causing that myocarditis. It may be severe. So far, nationwide, there's been nearly 6,000 cases, and there's been 52 deaths. In Vermont, we've had 1 confirmed case that's met the CDC criteria for case definition. As you can see by age, the 5 to 11-year-old group are the children that are most susceptible to developing Miss C, and that's in grade. That age is reflected in more than 40% of Miss C patients nationwide. What are the benefits of receiving the vaccine? Certainly, there's fairly equal between males and females, but they broke it down by age using the recent incidents. And so nearly 57 or more than 57,000, depending on male or female, cases could be prevented. You know, around 200 hospitalizations would be prevented, 130 cases of Miss C, and 60 to 72 ICU admissions prevented. So vaccine could make a significant difference for our children's health. I think Megan is going to take over now again.
Yeah, thank you so much. So let's weigh some of the risks and benefits of vaccination in the 5 to 11-year-olds. So this is looking at both those risks and benefits per 1 million of fully vaccinated 5 to 11-year-olds, both male and female. And so when you're looking here, sorry, I just need to close that little screen. There we go. Benefits that they were looking at were preventing COVID cases, preventing COVID hospitalizations, preventing COVID ICU stays, and preventing COVID deaths. And then the opposing risks were excess myocarditis or pericarditis, which is inflammation of the, basically like the sac surrounding the heart is the pericardium. So the risks are excess myocarditis cases, excess hospitalizations, ICU stays, and deaths for myocarditis or pericarditis. When they looked at this, the factors they didn't consider in the risk-benefit analysis were that the hospital stay for vaccine-associated myocarditis was much shorter than that for COVID infection. And also the vaccine-associated myocarditis usually is a much more mild course. So I think I've been on another talk and it was saying that usually for vaccine-associated, and don't quote me on this, this is from my memory, myocarditis was about a day or so hospitalization. And for viral-associated myocarditis was more about a week or so and usually more serious. So probably more longer PICU stay and more need for interventions. The other thing is that in this analysis, they didn't consider, because it is hard to measure, the benefit the vaccination will have on transmission of the virus by children. So even, you know, who are these kids transmitting the virus to? That's hard to measure, and that wasn't looked at here. The other thing that I have seen both as a parent and as a pediatrician is this disruption for the whole family, not just the student, to in-person learning due to illnesses and exposures. And many of you have probably lived through that and really felt that. And so that was, again, not a factor considered in this, but I think that is really important. And then any post-COVID conditions, which is kind of a broad term, but that's because that's still really being figured out. You know, we don't have a good delineation of what those are and how that looks quite yet. So when this went to the FDA, the voting question was based on the totality of scientific evidence that we have available at the time. This was done in November, this question. Do the benefits of the Pfizer BioNTech vaccine when administered as the 2-dose series, 10 micrograms each dose 3 weeks apart, Do the benefits outweigh the risks for use in children ages 5 to 11? And the answer was yes. Why is the vaccine dose based on age and not weight, which is another common question we get, especially for those kids who are 11 now and maybe will turn 12 sometime during this next, 365 days. Vaccine dosing is not based on weight because vaccines are not a medication. So I know some people often think of them that way, but they don't work at all like that. So just like your other antibiotics or things you get are based on weight, often vaccines don't work that way. And like I mentioned before, the vaccine really is giving information to your own immune system to tell it to do things that it would normally do, which is create antibodies in this case. So it's actually interesting. Younger children's immune systems need less of this prompting to respond and make these antibodies. So that is why the vaccine is a smaller dose in the younger kids. It's really based on your immune system maturity and functionality rather than a weight. So let's talk about kids under age 5, because they haven't really been addressed yet. So clinical trials are going on for children as young as 6 months old, and even smaller doses are being tested in these age groups. And there should be more info about that. I don't know if that's coming up in any other slides because I've looked at a lot of different information for this, but I believe that even by the maybe the end of this year to January, and someone can correct me if I'm wrong, there is talk of hopefully an EUA for that age group to be able to receive, I believe, the Pfizer vaccine. So the other question I get is, what about getting other vaccines at the same time? This, it's totally okay. So in the beginning, when adults were first getting the COVID vaccine, there were some different recommendations, but that has been shown to not be necessary. So it is absolutely fine to get the COVID vaccine along with others. And I would actually encourage it to not only get your annual flu vaccine at the same time if you haven't, but also to just stay up to date on all vaccines, because many people did skip or miss during the early on pandemic when we were still as offices trying to figure out how to safely see patients. They missed vaccine visits, and now I do think it is definitely safe to come into the offices, and we have, the differences that we've figured out as a scientific and medical community how to safely see all of you. The other important information is it does take around 2 weeks after you get your second dose of the mRNA vaccine, which the COVID vaccine is, for your body to build up that immunity. So that is why you're considered fully vaccinated 2 weeks after your second dose. And then important to note that the COVID vaccines are free, whether or not you have health insurance. That should not have to be a barrier. You can register. So the health department has COVID-19 vaccine sites to register for, and you can register online at that healthvermont.gov/myvaccine. The Vermont Department of Health started offering vaccination sites for the 5 to 11 age group on November 4th, and then school clinics began on November 8th in some locations. Some pharmacies also have the vaccine, and many offices, including Dr. Orton's office, have the vaccine. Some people have had questions about the supply, so there's been some uncertainty just because even Vermont doesn't know exactly when they're getting all the supply. I don't know, Dr. Judy, if you have heard, since you're getting it in your office. We don't have it in ours quite yet.
Yeah, it's getting a little bit better in this past month, and we we're actually having a parking lot clinic on Friday. I'm hoping there's not going to be snow, but we'll be prepared. We'll just come with our snow caps on. So that is open not just to my patients, but to anyone in the community. You can call and make an appointment. You could also drive in, but the surest way to make sure that we have enough vaccine is to go ahead and call ahead of time. But we take all comers. We are only offering the 5 to 11 this Friday, and it's just more of a logistics kind of thing. Feel free to call. We're going to continue to do that, just to offer that as an option. If you didn't want, here locally, the other common site is to going up to the old SVC. Some parents, they have anxious kids, and I personally have found that offering it in the cars, because we've been doing flu clinics that way for a couple years, that the children are a lot less anxious because they can stay in their cars. It's quicker. We come out. They can have their music playing or whatever, or their special toy. There is still that 15-minute wait, or 30 minutes if you have an allergy to something in the parking lot. But we're constantly in and out and watching out for everyone. So, but just to have lots of different options for families if they needed it.
Yeah, and that's great, Dr. Judy, that you offer that. And thank you for offering that to everyone, not just your patients. I do know that the vaccine site that she referenced up at the old, everyone still calls it SVC, where the college was, we're calling that the COVID Resource Center, the CRC, and you can go right onto the Southern Vermont Health Center website. A big pop-up comes up and it talks about the time there. Initially, there were more restrictive times of day for the 5 to 11-year-olds, but really, truthfully, if you go and they're open, they will pretty much give anyone a vaccine, and they will give the right one for age. But it seems like we have a wide open availability now in this area. And if there are people who are especially anxious or nervous, I have heard that concern a few times. There are some private rooms in the back, and if when you sign in, you request one of those, there is definitely someone that can do the vaccine back there. If kind of being in just one of the more open areas makes your child nervous. So finding vaccination sites, we kind of talked particularly about our area, but you can still go to that healthvermont.gov site. You can add, it's actually really easy. I've done it for my kids. I just signed up, I added my kids as my dependents, and then scheduled that. You also can use the call center to call if you need to get languages other than English, or if you need help, and then you'll give consent over the phone. And here are some resources for families, including the Department of Health, healthychildren.org, which is from the American Academy of Pediatrics. Really encourage you to look at that for COVID vaccine information and COVID infection. And there's just lots of great info there. And then the CDC has understanding how vaccines work. This is the Department of Health website, just a sampling of what that looks like when you log into the COVID-19 vaccines for children site. And there are actually, I think these are some pediatricians' kiddos getting their vaccine. All right, time for questions. I'll let you lead off,
Okay.
Brina.
Thank you so much, Dr. Orton, Dr. Gunn. Really great information, super helpful. So some questions have come in. We'll start, and you guys can just, take turns answering or defer to each other, whoever wants to jump in. My kid will be 12 in January. Should I wait for that full size 12 plus dose rather than the 5 to 11 dose?
I would not wait. Shots in the arms as soon as they can get it. Your child would get the dose that's appropriate for age. So I've had this happen to a couple of my kiddos, that they've gotten the 5 to 11. And then when they're due for their next dose, they're going to be 12, and then they get the quote adult dose, the next level up. If inadvertently they get the lower dose, it's not the end of the world. They'll still develop immunity, but there was kind of a line in the sand, so to speak, that they chose 12. At 11 and 11 months, is their immune system any different than they're at 12 and 1 month? Probably not, but basically we're recommending get the dose that's appropriate for your age, but don't wait. Just get them vaccinated, get them started, because as Dr. Gunn said earlier, it takes a couple weeks after that second dose. So in reality, it's about 5 weeks from start to finish before you have optimal immunity.
Yeah, I totally agree. I just know personally, oh, am I muted? No, you can hear me.
Yeah.
For my kids, I signed them up as soon as I could, and then they were due for their second dose over the Thanksgiving weekend, where we didn't have clinics here, but I actually sought out a pharmacy that was giving them. So we're not just saying get them ASAP. We really are doing that in our own lives and own families.
Oh, that's so great. Related question, but just to address prematurity. So my 5-year-old is premature and small for his age. Is the 5 to 11 dose safe for him?
That's a good question. But actually, I would say yes, absolutely. There are, this was, they use different sized 5-year-olds. I don't know for sure, but I would assume that they did factor in some prematurity. And typically, this isn't 100%, but typically in pediatrics, After children are 2 years old, if they were premature, we kind of consider them corrected for age is what we call that. So I wouldn't have a concern about that. And if they did have any ongoing, especially like lung issues or any other complications from their prematurity, I would even want them vaccinated more so. I mean, I want everyone vaccinated, but even more.
Right.
Even more so. Yes, I would agree.
Yeah.
Yes.
Terrific. Okay, here's a super common question. My child had COVID. Should they get vaccinated and when?
They need to have recovered from their COVID. So not in the heart of, that they have the stuffy nose or the cough or whatever their symptoms may be, and probably be symptom free for a couple weeks. But absolutely, because we know that natural disease doesn't give you long-term immunity either. I've have some families in my practice that are now gone their second round of being infected with COVID. And unfortunately, I haven't been able to convince them that vaccine is a good thing. And one of their children is too young, but definitely you want to get your immunity boosted. So the natural disease would give you a little bit of protection, but then the vaccine would make it even higher. And why not have the highest amount of protection that you possibly can so you don't have to go through it again? Or
Absolutely.
take the risk that you might
Terrific.
have to.
Yep. The
And I think
official
another part-
CDC. Oh, go ahead,
Oh,
Megan.
I think another part that comes into that is just that I've heard as a question is there used to be recommendations to wait 90 days after infection to get the vaccine, and that's completely out the window. My understanding is that was way back in the beginning of vaccinations for adults where we really didn't have enough, and so the thought was these people have maybe some immunity for 90 days. Let's prioritize the people with no immunity, but that is not a problem anymore. That I think that still was even maybe written on some official websites, but hopefully that's all gone now, because I even had that argument with my husband's coworker. I'm like, no, go get your booster. And I think you were going to say official CDC advice is
Yeah, well, I was just going to
once you're cleared.
Yes, so it 10 days from the onset of your symptoms, fever-free for 24 hours without taking medication, and then, as Judy said, symptoms resolving, if not resolved, and then go ahead and get the first vaccine available. But we always say, and we should have said at the beginning, as Meghan noted, Dr. Gunn, that this is an evolving science, and it's really important that we keep up. And that's why we love local pediatricians talking with families, because these types of specific real-time questions can be discussed with your child's physician so that you feel that you're up to date. Okay, what happens if my child gets sick with COVID between the first and second dose?
Oh, that's good. Not a lot. I mean, I'm sorry they were sick, but they have to recover, just like you said. And then I would still recommend their second dose, right, as on tight of a schedule as they can.
Yep. Agree.
Perfect. Can you talk more about how that messenger RNA works? Does it alter the DNA in my body? And is it some form of gene therapy?
So I know Dr. Gunn had mentioned this before, and I think we listened to the same podcast. Dr. Bell, our illustrious leader of the AAP chapter and pediatric intensivist at UVM, she had a nice way of describing it, that this is the recipe. So it's injected, the recipe goes to our cells. It tells the cells exactly how much flour and sugar and butter to put in there. And then the recipe gets eaten up and digested by the body and goes away. So it doesn't change our DNA. Our DNA is what it is. It just gives the recipe to the body to make the antibodies, these special proteins that when exposed to COVID will say, oh no, you're out of here, buddy. I'm going to ramp up my immune system, produce a lot of antibody and kick you out the door.
Yeah, I think that's important. And the other part that, people have asked me about, it also, that mRNA doesn't live in you. Like Judy said, or Dr. Orton, I'm so sorry, Dr. Judy, whatever. It does not live in you. That is destroyed like in a few days. And I think that is such an important part to just keep saying. And that's why I'm going to keep saying it over and over, which for me, I'm much more concerned about the virus and how long that could potentially, we just don't know how long that could potentially affect you, because we just don't have enough time on that. But similar, I kind of not compare it to, but so for the, like, if you get chickenpox, that virus can kind of stay with you, and that is what can cause shingles when you're older. And if we can prevent you from getting the chickenpox virus with the vaccine, you can't get shingles. So it's not an exact comparison, but I have used that example a few times.
Yep.
That's terrific. Okay, and I know you addressed some of this in the PowerPoint, but we like the repetition. I think it's helpful for us to all hear things more than once. So I'm still worried about myocarditis. What if my child has a heart murmur? Is there a risk for myocarditis from the vaccine with a heart murmur?
You want to go, Judy? You want me to take it?
Yeah. The risk from getting the disease, if you have not just what we term a functional murmur, just a little noise, a little turbulence we hear of the blood flowing through the pipes, but you had an actual defect in your heart, you are at higher risk for significant illness from COVID. The vaccine, as far as I've read in the literature, does not increase that risk. And in fact, vaccine-associated myocarditis is really mild. The kids may have overnight, at the most, a 2-day stay just being monitored, but they've all recovered very quickly. The risk is higher in males than in females, but and that's the case in many diseases that males get a little bit worse. But really, I wouldn't be worried about giving it with a heart murmur. And in fact, if your child has congenital heart disease, they're at higher risk for natural disease consequences. So be vaccinated.
And I'm actually thinking this, well, I have you two on here, are there really any conditions besides being a male and being at 16 to 17 especially, that put you at an increased risk for developing myocarditis after the vaccine? Not that I'm aware of. And you can't control being a male or being that age, and it's still not enough to recommend not getting the vaccine.
And the estimate for the 5 to 11 is probably overestimated. They wanted to err on the side of overestimating than underestimating. But I mean, 4 million doses, and we haven't seen anything yet. So that's really, really reassuring.
That's terrific. Okay, I've got a couple of good basic pediatrician questions. Do you recommend giving Tylenol before or after the vaccine?
I think Judy might be passionate about this one.
Yeah, I'm a little bit passionate about this one. I would wait to see if your child had any symptoms. Double check what the dose is, so you're going to give an appropriate dose, so that if they do have a headache or a little sore arm, you can do it. You can also use a cold cloth, cold compress on the arms. We usually tell the children, hey, get your arms moving and be active afterwards. In this past month, with lots and lots of children in our community getting it, I've had one call about a headache a couple days in, and the parents, correctly assumed that it was, I'm pretty sure this is from the COVID vaccine. It was pretty mild. They gave her Tylenol, and like, perfect. It went away, and that was it. And with children coming back in for their second doses, and I'm seeing for something else, how was it? And they're like, how was what? Your shot? Oh, nothing. It didn't even hurt. Like, cool. So, but, you could pre-vaccinate. I think initially when it rolled out with healthcare workers are pretty weenies, and we complain about everything.
Bad patients.
Yeah. But really, I think you don't necessarily have to give the Tylenol. You can just wait and see. They'll be fine.
Yeah, I agree. And I also it's anecdotal, it's not studies, but I really haven't had many complaints. I think these kids are, like I used to say, you're stronger than your mom, who was in bed for a day or two after her vaccine, and they love that. But really, I think they're doing really well.
That's terrific. How about some strategies for nervous or scared children prior to their shot?
Oh, that's a good one. I know that I think most people the kids know where they're going. If they're going to a different place, their doctor's office, you can't trick them into thinking they're doing something else, which I personally never like. I think you should be honest with your kids and tell them if they're going for a vaccine. I encourage them to bring something small that can be distracting or reassuring to them. So I know my son brought his little fidget spinner that he loves, so that kept him busy. My daughter brought her stuffy that she could hug. I think we also like listened to music on the way there that would just distract them from thinking about it as best we could. And I just gave them reassurance that yes, it does hurt for a second. And actually, my one kid didn't feel it, but yes, it does hurt for a second. And but then afterwards, once the shot's done, it'll be fine. Maybe a little sore arm. We'll go do something. I think I got them some fast food after as a maybe a little treat. I bribed them a little with that positive reinforcement. So those are some of my like parent things. What have you seen in your office that you've used, Dr. Orton?
Yeah. Certainly, there's been lots of Stewart's ice cream afterwards that I've heard about. So we did say go for it. One of the couple of the tricks that we use is, this was taught to me by one of my teenagers, is, you know, I swab their arm with the alcohol, I swab it on their hand, blow on your hand, even though they're blowing through their mask. It is a distracting tool. We usually try to get them to count. My one nurse is excellent about this. She's like, okay, start counting 1, 2, count to 5 and I'll be done. And before they even get out 1, she's done. And they're like, hold it, I didn't get a chance to count. So, you know, that's a couple of the strategies that we use. If they're more comfortable being hugged by mom or dad and in their laps, because obviously we're doing a lot of them in the car, then we do it that way, get mom and dad to hold their hands. There are a few parents and kids that I've seen in long term that we have mutually agreed. So you know your child. I mean, I don't like to lie to kids either, but there are some that get so anxious that we don't warn them. They just call, hey, we're, you know, Ella's here, okay, and we come out and they're like, what? Hold it, and no, count to 5, we're done, because they get so anxious. Or if they're in my office for a checkup, the really anxious kids, we just do the shots right off the start and then finish with the exam because they can't pay attention to anything else. And then usually I get oh, that wasn't as bad as I thought it was going to be. No, it's thinking about it is the worst. So.
Absolutely, and I do agree with you on that.
You know, they every year of my flu shot, they surprise me. They come into my office as I'm sitting at my desk. I'm like, okay, it's time. Okay, all right, because if I have to think about it, I'm, you know, healthcare workers are weenies.
Those were some really great thoughts and strategies. It's so fun talking to you. Just a couple more. We get this a lot. If breakthrough infections occur, why even bother to get vaccinated?
I've certainly seen breakthrough this fall as the Delta has increased. Infection, the amount of symptoms is pretty mild. That's probably the prime reason. It's just like the flu vaccine. Is it 100% protective? No. But do you really want to be in bed for a week with a fever and be miserable? Not really. COVID obviously is much more transmissible and more serious than the flu, although the flu is no walk in the park. So, you know, vaccine is going to decrease your amount of symptoms. It's certainly going to decrease your rate of hospitalization. I think right now, and Brina, you can correct me, or Dr. Gunn if I'm wrong, but I believe that 80% of those hospitalized right now are unimmunized. So
that's right.
You know, vaccine does work to prevent those things, you know, that are really our endpoints of concern, which is hospitalization, ICU, and death.
Well, and the other thing that I have thought of a lot is that, and I've heard that there are maybe some schools that are still discussing this, but at least as far as I know, here in our biggest local district, that if you're vaccinated and you're exposed, then as long as you stay asymptomatic, you can stay in school, which I think is another huge benefit, and you can still
participate in sports.
You can still participate. Exactly. Thank you. So I think that's another huge benefit that I've tried to use to just as like another pro.
Yeah.
All right, well, let's start to wrap up by answering the question about boosters for children. Are those coming? Will it be different? What? And you can speculate here because I think we don't know, but we're waiting.
I was going to say, do
And
you know something? I don't know, Brina. I mean, maybe.
6-year-old I've heard are coming soon to be boosted.
Okay.
So, and we certainly would recommend going ahead and getting the booster per whatever the recommendations for length of time that it ends up being. It will not surprise me that boosters would be needed for children, just like every year. The flu, you get boosted in essence because the type of flu changes just a little bit, and you want to have the most protection. Both of, Pfizer is obviously the only one that's currently approved for use in our youngsters, but even the Moderna can be changed fairly quickly to cover some of these variants and be produced so that within a few months we could be covering some of the more of the variants in our booster dose. If you're due as an adult for the booster, don't wait for that change. Just go ahead and be boosted. Part of the problem with the COVID, it's considered part of the coronaviruses, which is what causes most colds. And they've long, everybody, one of the, naysayers for vaccine is like, oh, this came out too quickly. No, it's been studied for 20 plus years because they've been trying valiantly to have a cold vaccine, but because it mutates, it's been hard to capture. I think they've done a really excellent job at Corona. The amount of the COVID-19, the amount of protection we get is phenomenal. Not anything that I would have ever dreamed of expecting. But I think we can anticipate that over the years that our children will need boosters. Maybe it'll end up being a once a year thing like the flu. Maybe it'll be combined with the flu. Who knows? That would really make life as a pediatrician simpler. But whatever it takes, we'll figure out how to get it done and give you guys reminders and help you out with that. I always tell my new parents, here's the immunization schedule. I'm not going to test you on it. That's my job to remember, but I'll help you through it. So the same way with COVID vaccines, we'll help you through it. Please call, ask questions. That's what we're here for.
Oh, it's
I have
terrific.
nothing to add to that. That was very
Yeah,
well
that was
said.
beautiful. Well, we've come to the end of our questions. We just have a few minutes left. I think I want to wrap up by saying that pediatricians want to be in conversation with families, and the commitment of Dr. Orton, Dr. Gunn this evening is that we know that there are risks and benefits that need to be discussed, sometimes in webinars like this, but sometimes one-on-one with your trusted healthcare professional. So this doesn't have to be the end of the conversation. We welcome the dialogue. We're so grateful that Vermont is talking because there's a lot to digest. There's a lot of information and we've got great pediatricians. So I really want to thank Dr. Orton, Dr. Gunn, our wonderful sign language interpreter, and Stephanie Winters from the American Academy of Pediatrics. It's a dark December night. We're grateful for your time and keep the questions coming. Any last
you,
words from the
everyone, so much.
doctors?
No, just thank you.
Try-
I echo that. Please keep talking to us.
Yeah.
Thank you, Bennington.
Bye, guys.
Good night, everyone.